Hi, I'm Angie Settle from West Virginia Health Right here with Your Health Done Right. And I'm excited today to have Dr. Stephen Eschenhauer, who is from the Kanawha-Charleston Health Department. I always just refer to you as the health officer, but what's your official title, sir?
Executive Director and Health Officer.
I was close. Executive Director and Health Officer of the Kanawha-Charleston Health Department. We have, over the years, with multiple health officers there, from Dr. Gupta to Dr. Sherry Young, and now you, worked really closely with the health department. We've always had a lot of respect for you guys, and what you do, and a lot of times our work kind of crosses over, and a lot of times we're able to partner on so many things. So I'm really excited to have you here today. Let's just start with the basics and just tell people about you and your background and education and training and where you come from and all of that. Just give us a little background.
Oh. Well, thank you, Angie, for having me on your show.
Yeah.
It's been a pleasure to serve our community at the health department, but before that I had a fairly colorful history. Started out in the military back in 1988 and retired from the service in 2018. Came in as a private and left as a physician.
Wonderful.
Took advantage of the GI Bill
That's
and
great.
a military scholarship, and actually got paid to go to medical school.
That's awesome.
Wasn't much, $600 a month, but,
Hey,
free tuition.
yeah, that's amazing.
And the military gives you, that wonderful opportunity to travel the world and see many different cultures, be in many different experiences.
That's great.
And at the same time, I got to take care of the best patients in the world. Our sons and daughters, husbands, wives, many of our soldiers, sailors, airmen from all over the country that I've got to take care of in many different environments. So I really enjoyed that part of my career, but like all things, it does come to an end, and I retired in 2018.
And then what did you do?
So after retiring from the service, I took a job at Jackson General Hospital as the medical director of the emergency department and the clinics. It was very interesting because we didn't know what was coming, and as you know, COVID was just around the corner after 2018.
Yeah. Yes.
And it was a very challenging period to be an emergency department director.
Sure.
We were many times overrun and under-resourced, as were most every hospital, every ER, almost every clinic. It was a very challenging time. So that was a really big look at taking care of our public here in West Virginia, but also seeing how strained and stressed our healthcare system became.
Absolutely. So tell me, are you originally from West Virginia?
So originally from West Virginia. I'm actually the 5th Dr. Eschenhauer.
Oh, nice.
So my grandfather came here as a physician in 1929 and was actually killed going to a medical meeting in 1979 in a plane crash. A very unfortunate accident. But he practiced here 50 years. And then I had my first two uncles, oldest uncles, were physicians. And then my other uncle married a physician, so she became a Dr. Eschenhauer.
That's cute.
Yes, and then I became the 5th of the Dr. Eschenhauer
That's amazing. And then were you from the Jackson County area?
So originally Mason County is where I was born and raised, and then moved down to Logan. My father worked for the phone company, so we moved around West Virginia some as his job took him to different areas, and then ended up graduating from Winfield in Putnam County.
So that's pretty neat. So after you did, travel the world with your, with the service and everything, but you came back to West Virginia to serve and take care of people here. That's great.
Actually, I got to come back to West Virginia in 2009 and took over as the state surgeon. It's a full-time position with the West Virginia National Guard as active duty. So I served in that position during my final 9 years of the service.
Oh, that's great.
So it was very good.
My dad is a retired Marine, so I have a lot of respect for people in service and everything that you've ever done. So thank you for your service, first of all. But we're glad that you came back to West Virginia and that you're at the health department now. So I know COVID was still going on when you took over at the health department. Was that a big transition going from an ER setting to a public health setting, or what was that a good break?
Not really, because when I was in the service, we actually do a lot of public health, a lot of preventive medicine. in my very first command in Korea, I learned very quickly that the health officer is also the public health officer on the base.
Gotcha.
And as the only physician there, we had to inspect the restaurant, the mess halls. Yes, we had to inspect food that came in. We had to inspect and test the water, make sure the sewage system was running well on the base. So I had a full-time environmentalist that worked for me, but the health officer himself was required to go out and do many of these inspections. And then, of course, preventative medicine is a huge part of military medicine, making sure that everybody is immunized, as well as their families, and being treated appropriately for diseases that they may travel with. Even in Korea, we had people traveling on to, say, Southeast Asia or to the Middle East and then coming back. So it
You had
really
to be familiar with what vaccinations for what areas of the world and all of that and travel. So that is very much in line with what you're doing now as, as health
and of
officer.
course, food is a big deal. You know, making sure that the mess hall
Foodborne
serving safe
illnesses.
foods.
Absolutely.
And,
proper temperatures and storage and
oh,
cleanup
yes.
and all that. So that's pretty much
In medical
in line.
school, we don't get any of that typically, so it was a
Yeah.
little bit of a learning curve. But I really enjoyed that part of it because it's so much easier to keep people safe than it is to treat an outbreak, whether it's a foodborne illness outbreak or a disease outbreak from an infectious disease. Like we had a mosquito issue, for instance. And yes, preventing mosquito-borne illness.
Yeah, absolutely, absolutely. So you probably got some experience with these really rare, remote type illnesses that we only hear about here. But when you're out in the jungle area and everything, you get experienced with that.
Yes, I've had the chance to see a lot of very strange things.
Things that we only see in textbooks, right?
Yes.
Yeah, so got firsthand knowledge.
Ross River fever from Australia.
Oh, wow.
Japanese encephalitis.
Oh, wow.
Cutaneous leishmaniasis.
Oh, wow.
Simian herpes from monkey bites.
Oh, my.
Things that I would never diagnose here, that even in medical school, we just really glance over a lot of tropical medicine because we just don't see those diseases commonly.
Right.
But it was very interesting to see real malaria cases as well.
Wow. Yeah, that's great. That's awesome. So here in West Virginia, tell me a little bit in your position, what you do. Just a lot of people don't know what a health officer does. Just kind of give me an overview of what you do, and then we'll talk more about the health department, how we work together and everything.
Sure. So a health officer does several things, and when you look at what our health department does, we have oversight of our clinical operations, and the main focus of that, of course, is immunizations.
Right.
And I'm a huge proponent of immunizations.
Me too.
Because I have been to the third world, and I've seen children sick with illnesses that we don't see here because we have such a superb and robust immunization program, one that protects our children from measles, mumps, rubella. I remember the first time seeing a child a few years ago in the Middle East with polio.
Yeah.
Just a tragedy, something that is so preventable with an immunization. And now that child is crippled for life. But it was just so sad to see that, knowing that could be prevented through an easy immunization.
I don't want to digress because this is one of my big soapboxes about vaccinations and how important they are, and we don't want to digress into all that. Sometimes there's anti-vaccine movements and everything, but that is one of the things that I always talk about with people. Historically, when I was a child, and I think I blame the internet a lot for that, and Facebook and all this stuff back when I was a child, when we didn't have all that. My mother would take me to my pediatrician, Dr. Lambrix, who since died, God rest his soul, and he would say, we need to do these vaccines, and my mom had faith in that physician. He would say, you need to do them, let's do them. We would do them, and that's how things went. You trusted your physician, they would tell you what you needed to do, you did it. Now we have all this internet searching, and let me go ask this one, and let me Google it, and then somebody's grandmother tells them they reacted to this and that, and I've really struggled before the COVID pandemic, during the COVID pandemic, because I thought, if anything, during COVID, people would learn how important vaccinations were and preventable illnesses. So that's something that's near and dear to my heart, what you're talking about.
Yeah.
And I feel like, as a society, I know that's not what we're here to talk about, but that people have become spoiled to the fact that they have not seen these horrible illnesses like polio and iron lungs and all these things that we have just become accustomed to, that we think that they don't exist, or that we don't need vaccines, that people think we don't need vaccines, but they have not seen what you've seen, what it could be.
Oh,
and,
yes.
and that's why I'm so adamant about reminding people about how important vaccinations are, because it's because we've been so effective and because everybody's worked so hard to keep those vaccination rates up that we enjoy the liberties and the freedom that our kids have of not having these illnesses. And that's one of the fears that I have as a public health person, of when you hear about, anti-vax movements and this and that people, and while I'm such a big proponent of keeping our vaccination laws intact in West Virginia, because they really have helped protect our kids. And just hearing you say that, I know you probably relate to that, but that's something that I fear, that people have become so lax with it, and we've just enjoyed that for so long that people don't realize, you're playing Russian roulette every time you weaken any kind of law like that, or you let any exceptions in. And the more exceptions you let in, it's like you're creating Swiss cheese, for your vaccinations, and these things can slip through.
Oh, yeah. Well, we're seeing it in America now. We have experienced polio cases in New York, here in the United States, for the first time in close to 50 years. 50 years without polio. Modern medicine, Dr. Salk, who invented the first polio vaccine, essentially we eradicated polio in America. And when some communities have let up on those vaccination mandates or requirements, it's going to come back, because there's still polio in the world. We're blessed to be in a country that is rich enough and has enough resources to vaccinate and protect all of our children.
And I've seen that, and I try to really watch that in the news. You'll see outbreaks of, measles and this and that, and all these things that are popping up, and people don't realize. They think, oh, it's just a rash. It's this. A lot of these illnesses, they kill, they cause permanent damage, like you're talking about with polio. These are not things to joke about. You've seen what the impact is, and I just pray and hope that, by doing our part as public health providers, that people get it, and we just got to keep spreading the word, because I feel like I'm going back to the thing with my pediatrician, that we're working against, internet stuff travels so fast. You get a false story and somebody shares it, and it's, the next thing you know, it's everywhere.
Yeah.
And people take that as gospel, even more than a lot of times somebody that they trust as their pediatrician or provider or whatever. And I guess that's my biggest fear as a public health person.
Absolutely.
Of that.
And it's undoubtedly the biggest role here at Kanawha-Charleston Health Department as the health officer. My encouragement to anybody that has a question about immunizations or disease, talk to your physician and trust your physician.
Absolutely.
Dr. Google, there's a lot of bad information coming from Dr. Google. Trust your doctor.
That's right.
As my grandfather said for many years, and I have adopted this saying, and I'll keep saying it over and over and over. The easiest disease to treat is the one you never get.
Absolutely. Absolutely. And, I'm not saying that there's not people out there that, have allergic reactions and all that, but I agree. That is the best philosophy. You get a provider that you trust. I have one. You don't treat yourself. You get a provider that you trust. You ask them. They tell you what they really believe, and I go with it. I don't want to go research it either. I don't want to go down a rabbit trail. I trust that person, and I go with that. And I really think that's important, that people do that. Build that relationship with a provider, with vaccinations, and do it. And don't, I don't fix my car. I'm not a mechanic. I'm not a plumber, okay? When I have that in my life and I need that done, I get somebody that knows that. And in medical care, I think it's the same thing. Don't try to do that and figure that out on your own. You really got to get somebody that you trust, like we do with our family. I have a pediatrician for my kids, Penny DeVita, love her. One of my kids has a well child tomorrow. We're going to go in there, and whatever vaccines are due, and she says they need them, we're going to get them. And I think that's so important what you say, because I think people have, shared so much, and sometimes there's distrust in the medical community and drug companies, and you hear all this stuff that just stirs up, and it creates so much doubt.
We saw during COVID an unprecedented time of medicine became political.
Yes.
And medicine is not political. It's human. It's about all of us. It's irrespective of age, race, sex.
Right.
All of that is irrelevant. We're all human. It's not a Democratic or Republican thing, or independent or Mountain Party or any party. It's about us, each and every one of us. And I so encourage all the patients and all of our public to, if you have a concern about an immunization, talk to your doctor about it first. Don't believe a pundit and put the politics aside.
I agree.
This is about human lives.
Yeah, because like you and I, we've been doing this for decades. You know, decades and decades, and there's no political base to it at all.
No, it's about the patient.
Right, you have to have ethics as a provider. You do what you think is right. You know, I treat my patients, you treat yours like you would your kids. I wouldn't tell anybody to get a vaccine that I wouldn't give my own kids. My kids are vaccinated to the hilt all the time. You know, we got to line up. We haven't got our flu shots this year. We got to line up. We're all getting them. I usually like to get them in October. So October's the time I usually like to do that. We got, got to get that done. Got to get that done. Been traveling for work though, but yeah. So I don't recommend anything that I wouldn't do for my own kids, my parents, me, myself, my husband. But I think that's great advice. I know we digressed a little bit, but that's something that's really important. I think it's important that our viewers remember about medical care. And to us, it's personal. It's something we really are serious about, and we treat people, you know, the way we treat our own kids. And same thing with vaccinations and everything. Let's talk a little bit, okay, COVID, big thing with COVID. We worked a lot with the health department. Part of it was with Dr. Sherry Young, who was there before you, but a lot of that stuff continued. But we developed a lot of partnerships and with the vaccination clinics, and we were like the mobile arm for the health department on the weekends when they did the big mass clinics. We would be the outside source. We were out there all bundled up and doing the drive-through vaccines for people that wanted to do that, while some people were going in the Civic Center with the inside. But we've partnered on a lot of things over the years, a lot of the public health initiatives. When we had to do some monkeypox vaccines, when that was an issue, you know, that was another thing that popped up right around in the middle of COVID. A lot of HIV testing and outreach, and hepatitis C, Hep B testing and outreach.
Yes.
I know you and I talk a lot on a regular basis, and, you know, try to partner up and make sure we don't duplicate services, but complement each other. So the health department and Health Right West Virginia Health Right have worked together for many, many, many years, and have had a really good, friendly relationship in that, because you guys do such great work. You're out there, and gosh, with COVID, it was so impressive how you mobilized, and we're out there, and we're doing everything, and we're everywhere. And we were trying to pick up some of the pieces and help where we could, but you all really were out there holding it down. And you know, COVID hasn't went away. We still have COVID cases and COVID vaccines and updates, and people don't realize all the work that goes behind that. Every time there's another vaccine or a new age group or something, you know, we got to pivot and roll and be ready to roll it out, and people expect you to be out there doing that. So how have you, I bet that's part of a lot of your job, keeping up with all the new vaccines and then this strain and then that strain and then that. And I know, I'm being honest, have not kept up with it as much as I was. But every time they roll out a new vaccine and a new strain, and then, okay, now we need this many vaccines, it's a lot to keep up with. How are you doing that?
So there is a lot going on in the world of vaccines. We've been very blessed in that, one, technology to make vaccines has gotten better and better and better.
Yes.
In particular, the mRNA technologies. A decades of research, and finally we're seeing the fruit of that. But another vaccine that a lot of people have kind of become COVID weary or fatigued.
Yes.
Let's talk about the RSV vaccine.
Yeah.
It has been in development for probably 2 decades, if not longer. I'm not sure when some of the companies started, but I know that the research has gone on for a very long time. And we finally have an RSV, that is respiratory syncytial virus vaccine. It has been researched and studied for a long, long time. And we now have a couple of different companies that have effective vaccines that are FDA approved. We do carry them at the health department. I'm not sure if Health Right has them yet, but we are carrying them.
There's some that we are not able to get, some that we are. I don't think we have that one yet.
Not RSV yet. Well, it's still very new. But RSV, let's talk about the disease for just a minute.
Yeah.
You see RSV twice in your life, typically below the age of 2, so when you're very young, and then in our retirement years.
Yep.
Our body forgets the RSV. It forgets the memory T cells, the antibodies tend to wane away, and our immune system's not as strong as it used to be.
Right.
And voila, it resurfaces again in our older years. And fortunately, we now have that vaccine for both young children and for the elderly
What are
to prevent
the
it.
age recommendations for that vaccine?
Typically under 4, but most kids get RSV by age 2. The majority do.
Right.
So they want to get that early, and their pediatrician, I would steer them to their guidance in case
About
there's
what the
any
timing is, yeah.
the timing and when they should get it based upon their particular health.
Right.
And then when you get to 65, you're definitely
65.
eligible for the adult RSV.
Yeah, and you hear so many hospitalizations and very sick kids with RSV.
Oh,
I hear
yes.
a lot, a lot. So that's really great news that we have
It's
that
just
now.
little kids, preschoolers. But last year, I was stunned at how many adults, and when I mean adults, I mean geriatric age patients that I had with RSV that required hospitalization.
Yeah.
Especially if they have lung disease that puts them at higher risk, such as COPD,
emphysema, all that.
asthma.
Right.
Yes. So I really encourage those adults, especially if you're at high risk, to get that RSV vaccine. We've waited on it for, I remember them talking about RSV vaccine when I was in medical school.
Yeah.
So
that's
it's been a
amazing.
long time coming, and we
Everybody
finally have it.
listen, people with young kids and those over the age of 65, you need to go out and find that RSV vaccine. This is yet another wonder of modern medicine to help prevent things. And, you know, I've heard so many kids over the years with RSV and being hospitalized and in ICU, very, very, very sick, very sick.
It can make them very sick.
As a mother, you just cringe, oh, RSV out in the community, or somebody has RSV and you worry about your kid getting it. So important that we now have that vaccine. Yet another way that modern medicine is helping protect us from these horrible diseases. And of course, if I had a child in that age range, we'd be out getting it right now.
Yes.
Absolutely.
And as Patriarch Dr. Eschenauer would say, the easiest disease to treat is the one you never get.
Absolutely. And I think people need to remember that. And that is the wonder of vaccines.
Yes.
I get excited every time we have a new one that comes out and think of one more thing that we can prevent, that we're not treating or trying to deal with the repercussions of or the aftermath of, but that you can prevent it. And the health department is known for that. I mean, all the exotic things. I know one time my husband and I went to the Dominican Republic and I had to go to the health department and get all these, all the vaccines
Whether
that you
it's
need.
typhoid or yellow fever,
all that stuff.
we carry it.
One of the few years back, there was a Hep A issue outbreak here in the community, and so for the first time, Health Rate got involved with the health department. We partnered up. We're out helping do Hep A vaccines for a lot of healthcare and food service workers and everything. So it's great, the health department. A lot of times, the health department is there working quietly, helping prevent and do all this stuff until something happens, like the water crisis years back, or when you have the Hep A, or COVID, and then all of a sudden people remember, oh yeah, look, they're there. They've been doing this all the time, protecting us with restaurants and doing all this stuff and having all the vaccines and everything available. And sometimes we just forget how important the health department is because they're back there doing that work every day, day in and day out.
When people aren't sick, when it's not on the immediate concern, you're sometimes forgotten. But let's talk about like hepatitis A and foodborne illness.
Absolutely.
It is a huge part of what the health department does. We inspect thousands of facilities throughout the county, whether it's nursing homes, public kitchens, restaurants, coffee shops. If they serve food, beverages, all the schools and all of the kitchens that they have, the cafeterias, I should say.
Absolutely.
They all require inspection to ensure that we're keeping a safe food supply. And our environmental team does a phenomenal job of doing that.
And that is a huge, huge, huge job to think about. Every restaurant, anybody that serves food, that you're out there checking it out.
Yes.
And that's to keep us safe. So that when we hit that drive-through or we go to that restaurant,
that
we're not getting. Absolutely, because, E. coli or anything like that, when you get a foodborne illness, it's no fun.
And usually when you get an outbreak, it's a number of patients.
Right.
Yeah, we want to prevent that and keep our community safe.
And I mean, that's not something we hear very often. Occasionally you'll hear, some on a cruise and this happens and that happens, but we're blessed, and in our community that you guys do such a great job and you keep us safe. We're not hearing that all the time. And that's
No, and that's okay. That's okay.
That's a good thing.
Sometimes
That's a
it's
good
good to be a
thing.
silent professional.
Yeah, so
Just keep
people
doing our
don't
job.
always think about what all the health department does. Do preventive things and, offer, female checks, and we do all this stuff and medications and all the things that you guys are into. I know the other day you were doing clinic. You're just so busy. TB and all that we have to watch out for,
Yep.
screening for all of that.
Yeah, we do TB and sexually transmitted disease clinic.
Yeah,
That
so important.
That doesn't sound like necessarily fun, but it's a very important community service.
All of those illnesses that are out there that are reportable, you guys have to track down, where it started, who all's been exposed. It's a lot.
So the
It's a whole lot.
epidemiology portion is another big element of it, of tracking down where disease came from and to try to treat anybody who is exposed. And our epidemiologists do a great job of that.
They're great.
Professionals
We
at
work
what
with a
they
lot
do.
of them. Absolutely.
And during COVID, they got worked to the hilt.
Oh, wow. I got a good first-hand exposure to what all you all had to do, track every person down. That's a lot. People are like, why are they doing it? That's the only way to stop it. You have to treat everybody. If you don't catch one person and they keep doing it, it just continues.
Yes.
So, I mean, we got a good first-hand view of how hard you guys worked so hard during COVID, doing all the tracing and tracking. Of course, as the disease progressed, things changed and morphed and all that. But amazing work that you guys do every day to protect the community.
We're blessed to have a great team at Kanawha-Charleston Health Department. A lot of people that are working behind the scenes to help keep our community safe. I was blessed to come into a health department that had a great leadership in its prior directors. Dr. Sherry Young did a great job during COVID, managing a very, very difficult situation. I was in a little different situation in the ER. Part of the same war, but a different battle.
Absolutely. It was different on all levels, absolutely. Because a lot of people, you hear about this closing down and that closing down, but medical professionals still, we had to go to work because it was still going on.
No breaks.
No breaks.
We got
no breaks
busier.
for that. Absolutely.
Much busier.
Absolutely. Well, we're almost out of time. I just want to thank you so much for joining us today and, just talking about the health department. Can't say enough good things again about the health department, the Kanawha-Charleston Health Department, and all the partnerships, all of the work that we do together. We're still out there doing a lot of, outreach events and testing events, and every time that we get a chance to work together, I'm always excited, and you can always count me in because you guys do such good work and share a lot of the same missions together. But I thank you for coming on today and telling us a little bit more about the health department. Every time I talk to you, I hear something new, I learn something different that the health department does, and one more thing that we need to be grateful for in our county.
Well, thank you, Angie. It's been a pleasure, and we love to work with West Virginia Health Right, a great partner, and we have the same mission. We're trying to take care of our community the best way we can.
Prevention is key. Take that away today, everybody. So much easier to prevent disease and treat it. Absolutely. Thank you so much.
Appreciate it.